Assalamu alaikum. In this video, we will discuss pernicious anemia. The word pernicious means dangerous, and the word anemia, as we know that the word anemia means that there is decrease in the total red cell mass in the blood. So, pernicious anemia is basically a macrocytic megaloblastic anemia which occurs due to vitamin B12 deficiency, and it mostly occurs when there is autoimmune destruction of the gastric mucosa of the fundus of the stomach. When there is autoimmune destruction of the gastric mucosa in the fundus of the stomach, then it means that there is destruction of the gastric glands. And when there is destruction of the gastric glands, then it means that the parietal cells and oxyntic cells are destroyed. So, when there is destruction of the parietal cells or oxyntic cells and the chief cells, then there is decrease in the production of HCl, and as well as there is decrease in the production of intrinsic factor. And we know that HCl is required as well as intrinsic factor are required for the absorption of vitamin B12 from the intestine. HCl is basically required for the conversion of pepsinogen into pepsin, which is responsible for the digestion of the animal proteins, and it helps in the absorption of vitamin B12. Similarly, intrinsic factor also binds with vitamin B12 in the small intestine, and it helps in the absorption of vitamin B12. So when there is deficiency of HCl and intrinsic factor, then it can lead to vitamin B12 deficiency, and the anemia which occurs is known as the pernicious anemia. Pernicious anemia mostly occurs late in life. It occurs after 40 years of age, during 60s, 70s or 80s. If a person is suffering from pernicious anemia, as it is an autoimmune disease, then there are also chances that that person may suffer from other autoimmune diseases, like there may be Hashimoto's thyroiditis, in which there is autoimmune destruction of the thyroid gland, or there may be Addison's disease, in which there is autoimmune destruction of the adrenal cortex, or there may be vitiligo, in which there is autoimmune destruction of the melanocytes. So, what is the pathology of the pernicious anemia? Actually, what happens in pernicious anemia is that there is formation of autoreactive T cells, and these autoreactive T cells are responsible for the destruction of the gastric glands. So, there is destruction of the parietal cells. When these parietal cells are destroyed, then they are broken down, and there is release of proteins from these parietal cells. These proteins go to the immune system, and immune system take them as foreign particles, and so antibodies are formed against these proteins. Now, in case of pernicious anemia, the antibodies which are formed against these parietal cell proteins are of three types. They react in three different ways. Some of these antibodies react with H positive secretors which are present in the parietal cells. These are known as antiparietal antibodies, and these antiparietal antibodies which act against the H positive secretors are normally present in 10 to 15% of the old age individuals. Then we have the second type of antibodies which act in such a way that these antibodies bind with the intrinsic factor at the vitamin B12 binding domain. Here we have the second type of antibodies, and this is the intrinsic factor, and these second type of antibodies are binding with the intrinsic factor at the vitamin B12 binding domain. Then we have third type of antibodies. Third type of antibodies also bind with the intrinsic factor, but these antibodies do not bind with vitamin B12 binding domain, but they bind with at some other domain of the intrinsic factor. So in pernicious anemia, we can have three type of antibodies. These antibodies are of great diagnostic importance, because if these antibodies are present, then we can detect that the person is suffering from pernicious anemia. The main destruction of the parietal cells in pernicious anemia is not by these antibodies, but actually the main destruction of the parietal cells is by these autoreactive T cells. Now, in pernicious anemia, there is not only anemia, or not only there is increase in the size of red blood cells, but also white blood cells and platelets are affected. The white blood cells become enlarged in size. They are known as megamyelocytes, and their nucleus is hypersegmented or hexalobulated. Then we have the platelets, and there is thrombocyte. In case of white blood cells, there is also decrease in the number of white blood cells, so we can say that the person is suffering from leukopenia also. Then there is also thrombocytopenia, and the platelets become less in number and also increase in size, so there is megakaryocytes present with thrombocytopenia. Now, what are the signs and symptoms which occur in case of pernicious anemia? Actually, the signs and symptoms of pernicious anemia are those which occur due to the deficiency of vitamin B12. So, what are the signs and symptoms which occur in central nervous system? We know that vitamin B12 is required for the normal myelination of the neurons. So when there is deficiency of vitamin B12 in the pernicious anemia, then there is destruction of the degeneration of the myelin sheath of the neurons, due to which there is subacute combined degeneration of the spinal cord. Subacute combined degeneration means that there is degeneration of the sensory pathways, as well as there is degeneration of the motor pathways. Then there is a loss of memory function, as well as there is psychosis. Next, we have symptoms of ischemic heart disease. Actually, we know that the vitamin B12 is required for the conversion of homocysteine into methionine. When there is deficiency of vitamin B12, then this homocysteine levels rises, and it is not able to convert it into methionine. This homocysteine causes destruction or damage to the endothelial cells, due to which there is activation of the platelets and microthrombi can form. So there are also increased chances of atherosclerosis and increased chances of ischemic heart disease. So we can say that the person may have chest pain, or the person may suffer from stroke, due to which there may be slurred speech or paralysis. So these are the symptoms which are related to the ischemic heart disease. Next, we know that the vitamin B12 is also required for the normal proliferation of the rapidly dividing cells of the gastrointestinal tract. So when there is deficiency of vitamin B12, then it results in that the cells of the gastrointestinal lining become large in size and they become small in number, and they are known as megaloid cells. So in GIT we have megaloid cells. Then what are the biochemical changes, or what are the changes which are seen in blood when we take the blood sample? In the blood we have the decreased level of vitamin B12. Then we have high levels of homocysteine, because homocysteine is not able to be converted into methionine. Then we also have increased level of melanic acid, because vitamin B12 is also required for the conversion of malonyl coenzyme A into succinyl coenzyme A. So there is also increase in the concentration of malonic acid, which also causes destruction of the myelin sheaths of the neurons. So also there is also symptoms of anemia, which include the pallor, shortness of breath, and easy fatigability. And due to anemia, there is also soreness or ulcers which appear in the tongue. So there is inflammation of the tongue known as glossitis. So this is all about the pernicious anemia. What are the signs and symptoms of pernicious anemia? The topic of pernicious anemia ends here. Next, we will discuss what are the causes of vitamin B12 deficiency. These are the general causes. These are not only causes of pernicious anemia, but these are general causes of vitamin B12 deficiency. There can be many causes of vitamin B12 deficiency. The number one, we can have diphyllobothrium latum or fish tapeworm infection. This diphyllobothrium latum consumes vitamin B12, and if a person is having diphyllobothrium latum infection, then there may be anemia due to vitamin B12 deficiency. Then if there is overgrowth of bacteria in gastrointestinal tract, then these overgrown bacteria can also consume vitamin B12, and it can also result in vitamin B12 deficiency. Then there is a condition known as tropical sprue. Tropical sprue is known as tropical sprue because it mostly occurs in tropical areas, and it is caused by some unknown etiological agent. Actually, what happens in tropical sprue is that there is atrophy of the villi of the small intestine, due to which there is decreased absorption of vitamin B12 as well as decreased absorption of folic acid, due to which anemia can take place. Then we have non-tropical sprue. In non-tropical sprue, this non-tropical sprue is also known as celiac disease. In non-tropical sprue, as actually the person has some allergy to food like some wheat, barley, or this is also known as the gluten sensitive enteropathy. Actually, the gluten which is present in some foods, for example in wheat or barley, can cause damage to the gastrointestinal lining, and there is decreased absorption of vitamin B12. Then we have the Crohn's disease. Crohn's disease is actually an autoimmune disease, and in Crohn's disease there is destruction of the gastric mucosa, and there is decreased absorptive capacity of the gastric mucosa, especially in the distal part of the ileum, in the terminal ileum. So Crohn's disease can also cause damage to or it can result in vitamin B12 deficiency. Then we have the TB of gastrointestinal tract. It also damages the mucosa of the gastrointestinal tract, or it results in vitamin B12 deficiency. Then we have the lymphoma in gastrointestinal tract. Whenever there is lymphoma in the gastrointestinal tract, then also the absorptive capacity of the intestinal tract is decreased, which can result in vitamin B12 deficiency. Then we have ileal resection. Then if there is increased concentration of nitric oxide, then it also decreases the absorptive capacity, or it destroys the vitamin B12. Next we have the gastric bypass. Gastric bypass is a condition in which the food passes too quickly through the stomach, and vitamin B12 is not released from the animal proteins, and it is not properly absorbed. So these are all the causes in which vitamin B12 deficiency can take place. Now, how we can detect that what is the main cause of vitamin B12 deficiency in a person? Suppose we have a person and he is suffering from anemia, and we know that this anemia is due to vitamin B12 deficiency. Now we have to find out the cause, that what is the cause of this vitamin B12 deficiency. In order to find out the cause of vitamin B12 deficiency in a person who is suffering from anemia, we perform a test which is known as Schilling test. Okay, first of all, we should know about the normal pathway of absorption of vitamin B12. Whenever we take vitamin B12, vitamin B12 is mostly bound to animal proteins. When vitamin B12 comes in the stomach, then here the enzyme pepsin act on these animal proteins, and vitamin B12 is released from animal proteins. Then this vitamin B12 bind with another protein known as R binder protein, which is coming from saliva. This R binder protein is digested away by the enzymes released from pancreas called proteases. Again, vitamin B12 is set free. Now this vitamin B12 binds with intrinsic factor. This intrinsic factor and vitamin B12 are taken into the ileum, and in the terminal ileum they are absorbed into the cells of the terminal ileum, and from the cells they are transported to the blood. In this way, vitamin B12 enters the blood. From the blood, vitamin B12 goes to the tissues. It is some part of it is stored in the liver, and remaining is excreted in the urine. So this is a normal pathway of vitamin B12. Now, how we perform the Schilling test? Okay, a Schilling test is divided into 4 stages. We have stage 1, stage 2, stage 3 and stage 4. First of all, in stage 1, we give the person radioactive oral vitamin B12. Oral vitamin B12 is given to the patient, which is radio labeled. Plus we give him vitamin B12 intramuscular injection, which is non-labeled, unlabeled vitamin B12 intramuscular injection. Now after we wait for 24 hours, and after 24 hours we will collect the urine of the patient. Now if in the urine of the patient there is high levels of vitamin B12, then it means that vitamin B12 is normally absorbed from the intestine, and it is taken into the blood. It means there is no defect in the absorption of vitamin B12. So if there is high level of vitamin B12 in the urine, then it means that there is some defect in the diet. There is some dietary deficiency of vitamin B12. But there is another case. It may happen that there is low level of vitamin B12. When there is low level of vitamin B12, radio labeled vitamin B12 in the urine, then it means that absorption is not proper. Vitamin B12 is not being absorbed. So now we have to find out the cause of that. What is the cause that vitamin B12 is not properly absorbed? So after stage 1 we come to stage 2. Now in stage 2 we again give the person radioactive oral vitamin B12. Along with this we will give the person oral intrinsic factor. Again we will wait for 24 hours, and after 24 hours we will collect the urine. Now if in the urine there is high levels of vitamin B12, it means that vitamin B12 is being absorbed. So there is defect of the intrinsic factor, and it means that intrinsic factor is deficient, and it means that the person is suffering from pernicious anemia. But it may happen that the person will have low levels of vitamin B12 in the urine. It means there is no defect in intrinsic factor, there is some other cause. So we have to find out the other cause. We come to stage 3. In stage 3, we again give the patient radioactive oral vitamin B12, and again with this we will give oral antibiotics. Now after the course of oral antibiotics, we will wait for 24 hours and then we will collect the urine. If there is high level of vitamin B12, it means now vitamin B12 is being absorbed. So it means that there was some bacterial overgrowth in the small intestine. But it may happen that vitamin B12 may be low in the urine. So we have to find out the other cause. We come to stage 4. Again we will give the patient radioactive oral vitamin B12, and along with this we will give pancreatic enzymes. Now if there is high level of vitamin B12 in the urine after 24 hours, then it means that there was defect in the pancreatic enzymes and there was pancreatic insufficiency. But again it may happen that there may be low vitamin B12 in the urine. So it means that there is no defect in all these. There is no defect in dietary deficiency of vitamin B12. There is no pernicious anemia, no bacterial overgrowth, or no pancreatic insufficiency. There is some other cause. So other cause may be ileal resection. So in this way we can find out the cause of vitamin B12 deficiency in a person who is suffering from vitamin B12 deficiency anemia. So this is all about pernicious anemia and general causes of vitamin B12 deficiency and how we can find out the cause of vitamin B12 deficiency. Thank you.